Welcome. Welcome to our AYUSH SAMRIDDHI webinar, international webinar series. I would like to communicate my sincere thanks to Dr. Shekhar Annam Potlaji for his kind support as ever. I would like to welcome Dr. Somesh Kaushik ji. Namaskar. And as usual, our guardian, Dr. Vishnu Prasad Sharma ji, ex-principal Guwahati Ayurvedic College and President Vishwa Ayurved Parishad Northeast in charge. डॉक्टर ओपी गुप्ता जी का भी स्वागत है. Should I continue in English or Hindi? It is also a matter of confusion because two foreigners are with me, experts of Ayurveda, and I am a simple Indian Ayurvedic person. So would like to welcome you by heart again, Dr. Shekhar, and first time Dr. Somesh ji. In Corona pandemic, the negativity was spreaded by all audiovisual media, as we are all aware of that. So we started this AYUSH SAMRIDDHI webinar series on different topics. Initially, we conducted our webinars on diseases, experts, clinical studies, and then we thought that our Ayurveda should be involved in day-to-day life, because Ayurveda is not meant for one day. So we should celebrate only Ayurveda day on Dhanvantari Divas, Dhanvantari Jayanti. So the day celebrated by WHO, UNO, national, international, whatever days are being celebrated, we would like to involve our Ayurveda in those days, and we are finalizing our topics according to the day celebrated on particular specific day. This is our new series, third series of AYUSH SAMRIDDHI webinar series, and inaugurators of this series, Global AYUSH series, are in front of me, Dr. Shekhar and Dr. Kaushik. I welcome them. This is first webinar of Global AYUSH series, and the second webinar is planned on tomorrow for UK, where 12 speakers will be there. So two opener batsmen of Ayurveda internationally fame is really, this is the blessing of Lord Shiva, that you valuable dignitaries are supporting us in this our journey. And now with your valuable support, we have been able to touch 184 webinar today. So this is our 184 webinar. Tomorrow will be our 185. Day after tomorrow 186 on different topics. So we have started two series more, GCP series, Good Clinical Practices series, which is being conducted on Saturday, every Saturday at 2 p.m. And this regular AYUSH SAMRIDDHI series on celebrated day, we are conducting from 4 to 6 p.m. IST in general. So thank you again. As per our system, I would like to welcome Dr. Shekhar ji. He needs no introduction. Very famous webinar master. I am on his way. Definitely, I am on his way. He is the webinar master, president of various associations, professor visiting, professor in, means whole over USA is covered by Dr. Shekhar. And now he has started one great initiative, AYUSH, Ayurveda expert, global Ayurveda expert. I salute him for this initiative. He is inviting with brand of his association, the CV, the detail, the forms, filled forms from MD, postgraduate of Ayurveda to become a global Ayurveda expert. I would like to support that initiative, and Now I would like to welcome both the speakers to spread the positivity in this negativity amongst us Indians and international audience, whoever will be watching on YouTube also. Please, Dr. Shekhar Annambotla. Namaskar. Swagatam. Kindly unmute yourself.
Morning and good evening to everyone. Welcome you all for giving a great opportunity for platform, this wonderful platform. And I respect all the dignitaries and as well as my colleagues, my friends, as well as my seniors, my teachers who are participating in this world reform on the globalization of Ayurveda and spread of Ayurveda around the globe. I'm especially thankful to Dr. Somesh Kaushik ji, who is one of the board of the director of the Association of Ayurvedic Professionals of North America, and Dr. Bhashwati Bhattacharya, who is the advisory board member of APNA, Association of Ayurvedic Professionals of North America, and other people. And personally, Dr. Pawan Sharma ji, he is my senior. Just we were discussing about that when I entered into the postgraduate studies in 1988. He was a final year student. He is a Guru Bhai. So he is guiding us and with the wonderful webinars and everything. And fortunately, we are able to do, this is my 195 webinar Ayurvedic series. So we'll continue our journey of expanding our knowledge and sharing our wisdom to everyone. Ayurveda does not have any boundaries. Ayurveda, even though it is born in India, raised in India, and taken care by our ancestors, our great teachers, Charaka, Shushruta, Vagbhata, all the people who has taken care. Now our contribution that spreading the knowledge of Ayurveda, trying to understand the concepts of Ayurvedic principles which are taught in the ancient textbooks. So language is the only barrier issue. So that is the reason here we are here as we immigrated to abroad. Like once upon a time in the history of Ayurveda, Itihasa, if you read it, when we are reading about Hippocrates, Galen, Aristotle, these are all the teachers who came from the west to east. And when we are studying about Ayurveda Itihasa in 1982, I was studying BAMS at that time. So we are fascinated that how these foreigners came to our country and learning of Ayurvedic knowledge. Now, Ayurveda, now west to the east, it is coming back again in a different format. It's not necessary that a new format is not coming, even though millennia Ayurveda was taught same principles of three doshas, five elements, Panchamahabhutas, it is not changed. But application and adaptation, everything has changed. The way of expressions changed. Limitations, boundaries, everything has changed. So here we are fascinated to share our wisdom with Dr. Somesh Kaushik with expertise, and he is senior to me, and he came to United States earlier before I came, and he is well known in the field of Ayurveda and naturopathic system of medicine and public health. And his introduction I will give you a little bit more detailed way later. But here my goal is that to educate you, all the participants who are participating around the globe, scope and practice of Ayurveda in USA. That is the topic today we are going to discuss. There's a plenty of scope. Is there a lot of people may think about that? Ayurveda is not licensed in the abroad. How can we practice? First question. Simple answer is that we don't need to have a licensing. Licensing job is not an individual job. Licensing is a job for the government job to protect the public. That is a governmental authority to take care about that. We don't need to ask them. You do your job, your protection. We wanted to have a license. There is no use of asking about the license. Like going to the abroad, I want to have a bicycle license. There is no license for the bicycle. You can ride anywhere, but you are not allowed to ride in the middle of the road. Legally is not allowed to ride middle of the road. Same way, Ayurvedic doctors are trained in the Ayurvedic system of medicine. They are not allowed to practice allopathic medicine. Simple, as simple it is. Same thing, acupuncture doctor who is allowed to practice acupuncture system of medicine, unless he proves himself that they have some additional training programs are there in the particular field. So that is the only thing is that we have to look into that. Then people will ask the simple question that does our BAMS degree is valid in abroad? Yes, it's a bachelor degree, and you can do master's degrees, and also you can do other contemporary degrees like a naturopathy degree and physical therapy and nursing and acupuncture. There are so many degrees can be done in abroad when you come here. That way you will be able to know about the various cultural ways to practice and how to integrate into this system like that. So a lot of people, when they are migrated to in this country, and they started to having different aspects of the different school systems, different educational systems, they can go through the process, and journey is there, but we have to work hard, then only you will get the fruits. Like you cannot get the fruits, mangoes, without putting a seed. Similar way, it is a journey of education over decades of time. People have spent, Dr. Somesh Kaushik, more than 4 decades. He is practicing Ayurveda and teaching Ayurveda around the globe. It's not like a one-day job. People think about that, sir, I completed my BIMS, immediately I wanted to come to America. I have a passport is there. Passport is not sufficient. You need to have an immigrant visa is required. Systems are required. The process are there. Like an American person, American doctor who wants to practice Ayurvedic medicine in India, he is allowed to practice? No, because he has to go through the process. Same way, it has limitations. Every country having its own limitations and boundaries, and everything is there. We can't take it like that, simply like that. Ayurveda can be, my grandfather has prescribed the medication, then we can do it like that, because there is a restrictions are there. And nowadays we can see the lot of people, particularly Indian community people, they say that oh, they know Yogaraj 4 or 5 names, Triphala, Avipattikara Churna, something like that. Then they declare themselves as Ayurvedic doctors, Ayurvedic practitioners. They know everything. Oh, Panchakarma, we know Panchakarma. What is Panchakarma? Application of oil on the head, that is Panchakarma. It's a science. It's a science. If you know how to put a band-aid, that doesn't mean that we go become a surgeon. Make sense? This is the thing we wanted to make sure that we have to have capability and credibility, and also competency is also very, very important. Then we can give the scope of practice, what to do, what not to do. We're not going to discuss more detailed way that what is the scope, completely scope of practice, because as it's difficult to say that we do not have any authority to invite you as an especially particularly in the green card holders and citizens. We don't have a control of giving the citizenship. We are not in the Homeland Security people. We are not like that. They have to go through the process. So we can guide you here in this platform. We can guide you what to do, what can you do in future, what is the processes. For that, there's a great scholars who came in earlier in the history of Ayurveda, Dr. Vasant Lad and Deepak Chopra. Of course, Deepak Chopra is a medically trained doctor. Dr. Vasant Lad, Dr. Robert Swoboda, all the people are there here. And of course, David Frawley is here. He's a Vedic astrologer and a Vedic scholar. So these are the people, luminaries are there. And these people has given a path. Before that, Maharshi Mahesh Yogi, he has introduced transcendental meditation in 1950s. At that time, when he started with transcendental meditation, slowly he introduced the Ayurvedic system of medicine, Maharishi Ayurveda. From that Maharishi Ayurveda, he has established at the university, Maharishi University of Management, and Maharishi International University has started in Fairfield, Iowa. So we are fortunate to work with Maharishi Ji directly. Then we spent years of time traveling around the globe and spreading the knowledge of Ayurveda, our goal. So more than 35 countries I traveled myself, 9 years I traveling with Maharshiji and the Maharshi movement and expanded this knowledge, sharing the knowledge. More than 40,000 medical doctors, health professionals, and allied health professionals, as well as general public, we trained them. We have provided the principles of Ayurvedic science. So in this experience of journey, with more than 30 years of experience and everything, so practicing more than 33 years myself, so we established an organization called Association of Ayurvedic Professionals of North America, APNA. So this is a non-profit organization, was established in 2002 as the inception in January 18, 2002. So from there, it is almost celebrating 19 years of celebration with the group of people we started, and various group of people are contributing. A tremendous energy has passed through them. The knowledge which has poured into the APNA, Association of Ayurvedic Professionals of North America, a contributions from the various scholars, experienced teachers, and all the people who are able to share their wisdom with the platform of conferences, educational forums, and as well as recognizing the various luminaries, experts in the field of Ayurveda, and researchers, educationalists, and practitioners, clinicians with different awards. This is the only organization giving the highest number of awards around the globe. If you go and look into the website, Global Association of Ayurvedic Professionals of North America, APNA, now we are proud to say that more than 100,000 members in this association. This is the only organization providing free supporting membership around the globe. And this is the only one organization, APNA is the one of the organization is recognizing the World Ayurveda specialists. That means who have completed BAMS, MD Ayurveda, MS Ayurveda, PhD Ayurveda, those people who can be registered as a World Ayurveda specialist. That does not mean that you are allowed to come to America and practice it. So by getting one certificate from the Association of Ayurvedic Professionals of North America is not giving a green card or something is giving like that. It is recognizing the people, and that is the only way we can spread. A lot of people may ask that, Dr. Shekhar, we wanted to spread the Ayurveda around the globe, or they wanted to come to America and practice Ayurveda. Why can't they practice in India? What is the success rate they have done? How many patients they are able to see? India doesn't have any patients. Plenty of patients. Plenty of number of patients are there. And limitations are there. There's a scope of practice. A lot of things are, you can do it, a lot of things in India. And at the same time, what I mean to say that we are here to support you because we are becoming citizens here. We are living here. We definitely, your research work can be published in our association APNA website, and your contributions. Share the wisdom and share the knowledge. Always our Ayurvedic contemporaries here, doctors, Ayurvedic doctors and Ayurvedic researchers, we share the wisdom to our students, our practitioners, our colleagues. This is the platform we are coming to here. And when we are creating the conferences and everything, we such a way that we put them together in a disciplinary action like that, disciplinary way to share our wisdom. That is the thing is very important. Here, Ayurvedic people having one background, one drawback is that they don't share their secrecy. Everything is secret. Even though Triphala they are giving for a constipation, sir, this is a formula is secret. My grandfather has given to me. I cannot share with you. When I share with you, it loses its potency. I don't understand that. I cannot understand the professor like that. And recently, when we came to India, one of the professors gives a medicine for the leukemia from Kottakkal Ayurvedic College professor. We invited him. I asked him that, can you share this information to our students? Sir, what ingredients you are putting? No, I can't share this information to anybody because if I share it, it doesn't work. It doesn't work. What nonsense. Whereas modern medicine, any doctor, he learns technique. People will go there and train him and properly train him. Then after that, send them out to practice more and more. Like So many hospitals here, Harvard, Yale, and Stanford, and all the John Hopkins. There's so many universities are there, medical institutions are there. What do? They support each other's systems, colleges together, they support each other. Whereas here in India, so sad to say that when Jamnagar University, Gujarat University is supporting something, Banaras University will not support. When the Banaras University is doing something, and Kerala universities will not support. What nonsense we are doing here. This is the biggest problem, is that we need to come together, share the wisdom, share the knowledge and everything. And after that, when we are sharing this knowledge, let it be open to the public. It's available to the public. When the public domain put this information to the public domain, maybe you can put a small disclaimer like that. This has to be taken under the supervision of the qualified Ayurvedic practitioners. This is the thing is important. Our practitioners, whatever they are doing, whether it is a BAMS first year student or final year student, anybody who is there, or MD first year student or final year student, we have to share that knowledge. So what we are doing here in the scope of practice here, how we are practicing. As we know that in 2000, before that, everything is available in the market, such as Rasaushadhas and everything is available in the market. In 2002 or 3, around 4, something like that, Robert Saper, who is a researcher, MD, MPH, he is from Boston area, and he has done some research on this individual Ayurvedic products from the various companies. What he did it, he has collected from the, not from the Ayurvedic practitioners, Ayurvedic doctors or something. What he did it, he collected from the Indian grocery stores, Asian markets, Brahadvachantamani, and all the different type of medications, which are easily available for Dabar Janmagunti. There are so many things are there which are commonly available, these medicines which are available. These are the Indian Patel stores, okay, or Indian grocery stores, or Pakistani stores, which are easily Safi. These are the medicines, more than about 40-50 medicines he has taken. He has done some research work on that, and laboratory studies are done. In the lab studies found that highest amount of mercury and lead and poison is there. Not permissible amount, beyond the permissible amount of medicines are there, high levels of things. Then it has come into the public as a big domain like that. It's a newspaper came. From that time onwards, if you see now, more than 100,000 articles are published on the side effects of the Ayurvedic medications. So that means it's illegal to practice Rasaushadhas. But Rasaushadhas, if you look into that, where the cast Aushadas are not able to work, Rasaushadhas are expert medicines. Now we have an expert, Rasaushadha expert person is here, Dr. Bhashwati Bhattacharya, who is MD, well trained, and as well as PhD in Rashi Shastra. She has done a lot of research work on these things, how efficacy of the Rasaushadhas are there. But the thing is that there is the same thing with the allopathic medicines such as antibiotics. These are the very powerful medicines like antibiotics, Rasaushadhas. Rasaushadhas cannot be given. Because the reason is that a lot of times when you go and ask the medical doctors here in America, if you wanted to have any antibiotic, they give clear prescription that whether it is allowed to refill is there or not. First question. Second thing is that how many days you have to take it, what is the dose, what is the contraindication, when to take it, everything the pharmacist gives the whole paper. The tablets may be 4 tablets, and this much of big papers or paperwork is there in the pharmacy if you go there. Why our system of medicine is failure is happening? For example, when we prescribe some medicine, Brahadvachantamani or Samira Pannagaras, some medication we give, where is the literature is there? One hidden literature is there, small page will be there. One, this thing, isko ye khao, itna hi. इसके साथ साथ कुछ भी नहीं मिलेगा, research नहीं मिलेगा, कुछ भी नहीं मिलेगा. Why? What is the problem with that? So this is the thing is happening. That is the reason Ayurvedic medicine. Yesterday I have a patient I have seen, and he was taking that, Dr. Shekhar, I am taking Brahadvachantamani. Who gave it to you? My grandfather brought to me. So grandfather is a doctor? No, just he is taking it. Now he is having a lot of weakness and everything is happening. He is taking Brihatva Chintamani since a long time. I told him that you have to go for the lab test for the heavy metal content in your body. Maybe probably you are consumed more than the quantity of the required, like that, without having proper prescription or anything you are taken. This is the biggest problem, is that the scope of practice is very, very clear that first of all, Ayurvedic practitioners should know about that. Do no harm. That philosophy is there in naturopathic medicine. Any system of medicine is there. Do no harm. That concept is very clear for you. Then you are able to clearly explain to the people what we can do it. There are plenty of Ayurvedic senior doctors or Ayurvedic practitioners are there. We definitely will support the people who are able to come to America. When they come to America, a lot of people who are practicing in this country and well-known practitioners, and they are successfully practicing with Ayurveda and simplified way. It's not like that. Ayurveda is not like giving a medications. Ayurveda, we know this knowledge. Ayu means life, Veda means knowledge, sharing the knowledge of life. In that is the one of the ingredient is called giving the medicine or supplement or dietary supplement. Is it only Ayurveda is based on the only supplements taking? No, there are so many modalities are there. So Kaya Chikitsa, Balarava Chikitsa, and Prasuddhi, so many branches are there, subdivisions are there. People may think about that. Oh, one patient recently said, you have so many branches. You have to study Ayurveda for 5 years. This is the thing is pity situation like that. We need to showcase our educational background, what we have it, how much training is undergone this training program, how laborious training is required, how systematically it is studied and everything. This is the biggest problem, is that first of all, we need to showcase the study and everything. Of course, there are some of the people who are interested people like that, Ayurvedic lifestyle coaches or lifestyle consultants. So a lot of people, yesterday I got one BAMS doctor from India. She sent an email to me that Dr. Shekhar, BAMS, postgraduate diploma in Panchakarma. Now she wanted to study Ayurvedic lifestyle consultant program from America. Like a PhD student wanted to join in the kindergarten. A PhD student wanted to join in the first kindergarten. Can I come to the kindergarten class? I am eligible to join in the kindergarten classes, like that. What is the meaning of Ayurvedic lifestyle consultant? Ayurvedic lifestyle consultant means Dinacharya, Ritucharya has to be followed. How many Ayurvedic doctors put your hand on your heart at Brahmi Muhurte Uttiste? This is the word we studied in Ayurveda. 4:30 you wake up or not? Brahmi Muhurte. How many people are raising their head and to show their face to the Surya Bhagavan? No. This is the biggest problem. If you see that Dr. Pawan Sharma is raising his hand, but the thing is that I woke up at 4:30. Every day 4:30 wake up. The reason is that why when we wake up at 4:30, that is the reason I always take the time for the people to give the webinars and everything in the morning. So first of all, Ayurvedic medicine starts working at 4:30. One patient asked me that, Dr. Shekhar, at what time I have to take this medicine? Exactly 4:32. Why, sir? Why should I take 4:32? I am sleeping. Then that doesn't work. Ayurvedic medicine does not work after 4:32. That means you wake up at 4:30, brush your teeth and everything, take this first medicine. That means, what is the thing we are giving? Simple, maybe Trifalavan tablet, or something like a Guduchi tablet, or something like that. It is a placebo. But more medicine is, medicine part is that 4:30 Brahmi Muhurte Uttista, that is the best medicine. That is called lifestyle medicine. So this is the thing is we need to learn. And I asked all of the, sir, a lot of BAMS doctors here, practitioners here, and some of the practitioners are not practicing. They change their profession to the various jobs, like that. They're like software engineers or software practicing or something, computer technology, something they are doing. And some people, they went to the medical schools. BAMS doctors went to the medical schools because they don't believe the Ayurveda. Some people, they went to the nursing schools. Some people, physician assistants, various ways they are practicing. And recently, I have a physician assistant program. This is almost like a medical program, full medical program. She's a BAMS. She is asking me that, Dr. Shekhar, I've forgotten the Ayurveda. Can you teach me Ayurveda for the physician assistant? I said that, what should I teach you? Vata, Pitta, Kapha? And then first of all, I asked that, what time you wake up? I work until 2 o'clock at midnight. After 2 o'clock, I wake up at 9 o'clock and I never, these things. That is not Ayurveda. Acquiring the degrees are not Ayurveda. Ayurveda is a practical science. Ayurveda is not a dead science. Ayurveda live science. And every practitioner, every listener in this lecture has to remember that. Morning, wake up at 4:30 and do sun salutations, yoga, breathing, whatever the things you are doing. That is the thing is that first to start. First to be healthy. You healthy and you can teach others. If you are not healthy, a diabetic specialist who is suffering with diabetes, he cannot cure himself diabetes, but he is giving the medicine for the others. What is the use of it? A obese doctor, and he is making you to lose weight. He has a miracle medicine. One guy is having it's interesting that one doctor is there. He is having a big belly. That is called pot belly. We call pot belly. Okay, huge belly. I asked him that. I asked questions such a way that, doctor, do you have a medicine for reducing the weight? Oh my God, I have plenty of medicines. Oh, what you give? I cannot tell you, but they have to come and work with me. 30 days, I make them to lose weight. And also particularly, what about the belly area? Definitely, it is going to lose. Then finally, I asked him that, sir, why you have not used it, sir? Why you have not used this medicine? In 30 days, you are able to guaranteed. I asked him that, guarantee? Yes, guaranteed. I can definitely cure the problem. But what about you? His face is completely changed. Why? Why we need to cheat the people? Why we need to bluff the people? This is the biggest problem, is that our goal is that to, as an Ayurvedic practitioner, be honest. Be honest what you are doing. That is exactly what we are doing. Our students who are Western trained American people who are living with us, those people who are there with us, what is happening there with us? They are clearly mentioned. They clearly mentioned that, sir, are you practicing? First, the student will ask, American student will ask that, sir, are you waking up at 4:30? Yes. Yes. We wake up, we teach them, and surprisingly, 8:30 to 9 o'clock, I go to bed. Patients surprised that is the time. And you try to call me at 9 o'clock. I will not wake up your phone call. I will not take your call. Pawanji knows. This is the thing. Ayurveda is a disciplined way to practice into your day. That is the scope way of practicing is there. Very simple way you use that. Not like how many medicines you are giving and everything. First of all, a lot of people, when they come to my consultation, what I do, I educate them. First, what is Ayurveda? What is the way of these things? First, because a doctor means to teach. Doctor means having a stethoscope in the neck is not become a doctor, or white coat is not a doctor. That is the allopathic way they are doing. What is the speciality of the Ayurvedic Vaidya? Ayurvedic practitioner. First of all, what is the thing is that Ayurveda, what is the thing? Ayurveda has to be done. Maharishi Mahesh Yogi, once upon a time, what he said that in India, Ayurveda is not practiced. Only Ayu is practiced. Ayu clinics are there. There is no Veda knowledge. Veda is lost. There is no education. And the way of yesterday, Lucknow ladies came. She's my patient. And she was telling to me that tomorrow she's flying back to India. She said that Dr. Shekhar, what you are teaching, the way of teaching of Ayurveda, it's much easier. India, doctors, I asked the Ayurveda doctors to teach Ayurveda. Nobody is ready to teach me Ayurveda like you, what you are teaching. That means America has to teach Ayurveda to the Indians. That is a pity situation. Why? It is shameful for us as the Indians. I wanted you to do that. Pawan Sharma ji is doing such a wonderful webinars. I wanted him to do 1 lakh webinars, not only 190, 100, 200, like the 1 lakh webinars. 100,000 webinars has to be done by the Dr. Pawan Sharma ji. I am behind you. I am working with you. No problem. We have a competition between you and me, and a strong competition between you and me. It's a 1 lakh competition webinars. We will do it together. That's the way, independently, of course. But we will promote it such a way that we have to spread the knowledge to the everywhere. Look and corner. Everybody has to learn about that. My goal is that in America, the household name, Ayurveda word is become a household name. That is my job. So then that means everybody should know about what is Ayurveda, what is the principles of Ayurveda, and we will make sure that then we have plenty of people can come and practice. There is no competition. Dr. Kaushik and me, we talk about that. Dr. Shekhar, competition is good because then only we will grow. If the competition is not there, we are dead. Like in the competition, Olympic Games are going on, 10 people are running, then you have competition is there, then racing will be going. And minutes, seconds, it is going time like that. Whereas only one person is running and he is the only gold medalist, no use. Or 3 people are running, first person runs, second gold medal, second is a silver, third is a bronze. It is no use. I wanted to have 3,000 people are running behind us. More practitioners are practicing Ayurveda and spread the word of Ayurveda, but at the same time, ethics has to be maintained. And our ethics committee chairman and also a lot of public health. Regarding public health, he talked a lot of information. Dr. Somesh Kaushik is expert. Public health protection, public health administration. He has so many master degrees, masters in public health, masters in public administration, naturopathy degree, and yoga expert, as well as Ayurvedic BIMS degree. So many talented degrees he is holding like that. I will leave that topic for him that how the protecting ourselves. First of all, we need to think as an Ayurvedic scope of practice is that first of all, protect the public. Protect the public. That is a very, very important factor. We look into that. Always we look into that aspect like that. How to protect the public. Even if you are giving Triphala, what are the side effects are there? You are able to tell. Even yesterday, one patient asked me that, Dr. Shekhar, can I put Dabur, the rose water, can I put in the eyes? Is there any indication mentioned on the Dabur bottle, water, the rose water? Here, I have it here. I'll show you. This is the Dabur rose water. It's clearly mentioned here. External use only. Even you are not allowed to consume also. You cannot put this one in the lassi. We don't know. What are the side effects are there? It can create a diarrhea. It may create acidity. Anything. It's clearly mentioned that external use only. What I do, I take this liquid in a form of like a facial mask or external burns or something that we will apply external rose water or spray on the body. Not in the drops, in the eye drops. This is not eye drops. This is not eye drop. Nobody sells eye drops this much big container. So, oh, my grandfather used it. Go and practice with grandfather. No. This is not a way to practice. We are the qualified practitioners. We educate the public. We educate the public clearly that what to do, what not to do. And a few days back, a patient asked me, she's pregnant. Dr. Shekhar, my grandmother recommended to take Simhanada Gugulu. And she is a 7th month pregnant, I think 7th or 4th month pregnant. She has a lower back pain. And she calls me that, can I take Simhanada Gugulu? Then grandmother is taking, because grandmother having an already knee joint pains and problems are there. She was taking. I said that that is prescribed for the grandmother, not for you, a pregnant woman. How can you take it? Because you know that you wanted to lose your baby, then you can take it, because it's having castor oil is there. Castor oil is abort efficient. How can you take it? This is the thing, is very, very important, like that. People are taking it without consent of the practitioners, without consent of the doctors, Ayurvedic doctors. They are taking it as safe medication. Ayurvedic medicine, a lot of people think about that. They're safe medicines. Ayurvedic medicines are safe. No, they are not safe. Who said that? Who's safe? Ayurvedic medicines are poisonous also. If you take unnecessary medications, can create the problems. So one has to think about that. Everything has to be given prescription by the qualified Ayurvedic practitioners, well-trained people. Lifestyle management, that is the reason what we did it in America. The scope of practice is changed from the levels like that. If you go to our website, Apna Association of Ayurvedic Professionals of North America, I would like to share the screen to you, all of you. Share the screen. Here you can see the scope of practice of Ayurveda. So this is the association. We have started this organization and everything, and this is the today's session. And I would like to conclude with a few minutes and session. Then I will give the next speaker. The vision, mission of the Ayurveda. This is all the information posted there. Now this is the biggest organization, global organization. More than 100,000 members are there around the globe, and that means it's a free membership. All the participants go to the website and go to the apna.org. Free membership is there. Register yourself. You can tell your friends, colleagues, your students, anybody. Tell your name, their names also. You can tell us. We'll be circulating their information to them, and we'll updating the information on the website and everything. We'll post it, and we'll give the certificate, digital certificate, to all of you. And 134 countries and more than 100,000 members are participating. Next year we are celebrating 20th anniversary. These are the accomplishments, various accomplishments we have done. And BAMS Vaidyas, all the BAMS Vaidyas, Ayurvedic practitioners can register. If you are in India, you don't need to register with us. You can stay there in India with AYUSH, Ministry of AYUSH, Government of India. You can register. BAMS people who are living abroad, other than Sri Lanka, Nepal, and India, where these countries are already licensed professions. People who are in South America, Africa, and Brazil, and various countries. People can join with APNA. We will be creating a database of the Ayurvedic practitioners, BAMS qualified people. And this is also free registration. You can do it like that. You can register with us. And we have also board certification. People who are on various levels of board certification is there. Registered Ayurvedic practitioner can eligible to join in the board certification like that. This is the all scope of practices we can do. Scope of Ayurveda practitioners, various levels of training. We have laid down together. This is the only the organization having highest number of recognizing of Ayurvedic qualification people like that. Like Ayurvedic lifestyle consultants, with a minimum 500 hours of training is required. Ayurvedic health counselor, minimum 1000 hours of training, including this thing. Ayurvedic practitioner level is the 2000 hours of training. Ayurvedic doctoral level program, which is an BIMS or higher degree holders, which is those people with called more than 4,500 hours of training is required. Doctor of Ayurvedic medicine, DAM, which is equivalent to MD and DO degree, DAM degree, and which is an integrative Ayurvedic doctors. That's people who are medical doctors, chiropractors, naturopathic doctors who has a background of Ayurveda. They can be eligible to join as integrative Ayurvedic doctor. That means they're integrating Ayurveda into their main practice like that. They are not a real Ayurvedic doctors. They are the integrative Ayurvedic doctors. That means they are integrating Ayurveda like into their practice. And integrative Ayurvedic researchers, they are PhDs who are doing research. For example, Dr. Ram Mohan Rao, who is our board of director, Dr. Ram Mohan Rao, PhD in neurosciences from California. He is an integrative Ayurvedic researcher. He has done a research work on the ashwagandha in the Alzheimer disease. And we have an Ayurvedic food and nutrition consultants. They are focused on the food and nutrition, and Panchakarma therapist, who is a Panchakarma technician or a therapist, and who is having 1,000 hours of training is required according to the World Health Organization guidelines of benchmark training. And Ayurvedic yoga therapist, yoga training with 500 hours of yoga training with a registered yoga teacher or some yoga training is there. In addition to that, they have fundamentals of lifestyle coaching and everything is required. That means Ayurvedic lifestyle consultants can be joined together, combined together, the integrating Ayurveda of Ayurveda and yoga therapy. And Ayurvedic Marma therapy, which is 1,000 hours of training, Ayurvedic herbalist, and each and everything is 1,000 hours of training is required. Ayurvedic aroma therapist, Ayurvedic pharmacist, Ayurvedic polarity therapy, and as well as Ayurvedic doula therapist. Doula means here it's not a midwife completely. They are not a midwife, or they are nurse practitioners. In between, they are supporting us, and some states they recognize them as a licensed profession. Some states does not have a licensed profession like that, but they can work in close connection with the nurses and midwives. They closely work with them. That's called doula. And Ayurvedic psychology consultants, and Ayurvedic beauty and spa therapist, Vedic Vastu consultants, because Ayurveda is also Vastu Shastra is also part of the Vedic sciences. That is the reason we have considered it as a Vastu Shastra. Is Vastu means Stapatya Veda, Stapatya knowledge like that. And Ayurvedic Vedic astrology, that is Jyotisha. Jyotisha is the part of the Vedic science. It's not like we are left alone knowledge, not like that. Ayurveda is also because macrocosmos, microcosmos to macrocosmos, yada pinde tada brahmande, the cosmic theory is there, and medical astrology and everything is there. Of course, now you can see that everybody who has a beard and white robes are there, they becomes a guru. Anybody, there is no qualifications are required for that. Anybody who has the beard is there, or having a white robes or saffron robes are there, they become a guru. So if you happen to see this movie called Kumare, movie, if you're able to see that movie, Kumare, that is a way of doing it. These are the people who are giving spirituality. By the name of spirituality, they are scandaling and everything. We have to be very careful with these people like that, who are meditation and spirituality like that. And this is the thing, wrong knowledge is provided like that. We wanted to recognize the qualified people. There's no restrictions of these people there. There's no licenses there. Like giving a licensing for the beggars. We need to give a qualified beggars, whether the qualified beggars are there or not. That's the thing, we need to look into that. And this is the World Ayurveda Specialist. Those people who have listed there, more than 170 people registered now. This is also free membership who can join in the APNA as a World Ayurveda Specialist with the minimum BIMS, MD Ayurveda, other qualifications like that. They can do it at World Ayurveda Specialist. This is also fellow of Association of Ayurveda Professionals of North America, can join the association membership. These are the board of advisors from the various our board of directors and the board of advisory group like that. This is the thing. And we have a board of advisors here, list of the people, and then board members. Even Dr. Somesh Kaushik is here. He is also a director of the Professional Ayurvedic Continuing Education from Connecticut. He is the director for the things. Board members, we have board members. These are the various qualifications which I put them together, various informations on the website. This is, if you go to the website, all the information, what credentials, what is the scope of practice for each and every level, which has shown very clearly that in the website, it has shown clearly like that. Let me stop sharing. Good. So there's a lot of information which is there posted on the website, and because it's clear, the picture is clear, the information is clear. We are here to support you, all of you, welcome you all, and we do the conferences, various conferences, international conferences. You are most welcome. If you are talented, experienced, and well versed in speaking, you are allowed to come and speak. That is the important, because we wanted to showcase you, your talent, to abroad audience. We will also learn a lot of information from you. Dr. Of course, now here Dr. Joshi is here, Venkatnarayan Joshi. He is my senior to me, also in the Gujarat Ayurveda University, and he is MD, PhD from London. He is practicing, and we invited him for the speaking in the conferences. We appreciated them. Unfortunately, the people who are sitting in the conference hall, I have done, because I have a wonderful experience in the practice like that. And people are going outside and chatting with each other. Hey, what lunch you are preparing? This is the only thing they are talking. And whereas Dr. Joshi is talking something, only 40, 50 people are there, but registered 300 people are there in the conference. Where they are there, they are drinking chai, same habit. Same habit is not, the habit is not lost. Same thing is happening in the Ayurvedic college, what they are studying, the teacher is teaching, students are sitting under the tree. Why? Why we need to shame ourselves? This is the biggest problem is that it is a shame on us. It is a shame on us, utterly shame on us. That is the reason we are failure. We are the failure is the reason is that that is the only thing is that we are failure. Success comes with the hard work. Knowledge is some level of knowledge will be there. Discipline is very important. Self-discipline is very important. Once you know the self-discipline, how to do it like that, Dr. Somesh ji, morning now he has to go back and do consultations now. And with the valuable time, he's a lot of patients, he is waiting for, patients are waiting for him, but he has accepted only one word. I said to him that, Dr. Somesh ji, please join, मेरा बड़ा भाई बुला रहे हैं तुम्हारे को, आना है आपको. चलो गुरुवार बृहस्पतिवार बहुत अच्छा है नॉलेज के लिए, चलो उसको एक्सेप्ट करेंगे. यही मेरे को याद है, बृहस्पतिवार बोला है उसने, गुरुवार को बोला है, चलो एक्सेप्ट कर देंगे. Tomorrow morning, early morning 6 o'clock, I had to give a presentation early morning 6 o'clock in the Kolar Medical College. Dr. Devaraj Urs Medical College Physiology Department, they invited me to speak. So I am giving presentations. A lot of things are there. All these things are there. Discipline. And when I do the conferences, I invite the speakers to come. Dr. Shekhar, I am busy. In my 33 years of my practice, and I never missed one lecture. When I committed, I did it. Even when I have a fever, one day I had a high fever. I have taken Tylenol tablet, reduced my temperature, I gave a lecture. That is called dedication, a commitment. You are expected to do it something on that day. You cannot escape it. I remember those people who have escaped from me. They will never be invited back again to my platform. 100%. Sorry. The reason is that dedication is not there. Dedication is not there. Those people who are dedicated, this is the thing, how Ayurveda scope and practice of Ayurveda is successful is that because of hard work. If you know how to do hard work, if you know how to wake up at 4:30 and go to bed at 8:30, you are eligible to come to America. Thank you very much. Namaste. Now I will invite Dr. Somesh Kaushikji, I will give you a little bit further information about him. He is a recipient of Dhanvantari Award from the APNA. He is an expert. As I mentioned to you, he is a BAMS from Kurukshetra, from the AYUSH government of Kurukshetra College. And then he came to United States and further studied Masters in Public Health, Masters in Public Administration, and as well as naturopathy degree, a licensed physician, and working in 2 states, not only in Connecticut, in New York also, and the biggest states, and where he practices. And his wife is also a naturopathy doctor. His 2 daughters are also naturopathy doctors, licensed physicians, whole family of physicians. He has but still he practices Ayurveda in such a way that, and one of the Ayurvedic student, BAMS graduate, wanted to get admission into the naturopathy degree college, and he was mentioning to me, I know her personally also, she came to me. She is the one BAMS student completed from Haryana area, and she wanted to join in the naturopathy college in Bridgeport. Dr. Somesh Kaushik is the expert committee member for selection committee. He invited as Ayurvedic medicine doctor and the naturopathy doctor, he invited in the board meeting. First of all, he asked a question. Oh, she is Ayurvedic doctor. Okay, let's ask her one question. What is Ayurveda? She doesn't have answer for that. She doesn't know what is Ayurveda. Ayurveda is a natural medicine, sir. She thought that he doesn't know anything about the Ayurveda. Then she thought that, okay, let me give any answer for him. Like that, Ayurveda is science of life, sir. Knowledge of life, sir. That is not Ayurveda. Hita hitam sukham dukkam ayush tasya hita hitam manancha tasya yatroktam Ayurveda sauchyate. That is Ayurveda. That is the definition of Ayurveda. Hita hitam sukham dukkam. This is the word he wanted to listen his ears. 30 years he is waiting for that word. Hita hitam sukham dukkam. That is the word he wanted to hear from the BAMS graduate. Not science of Ayurveda, life of Ayurveda, origin in Ayurveda. This is not a definition of Ayurveda. So, I do respect, I invite Dr. Kaushik ji to join with us, and he will give wisdom, wonderful wisdom for us. Thank you.
Dr. Shekhar. And thanks, Dr. Sharma ji, for inviting me on this platform. So we are thankful to our ancestors, Bhagavan Dhanvantari, and all the gurus and all the knowledge-filled people who left this information for us to follow. So we, the human beings, can be healthy because we are all here for a purpose. And if we are healthy physically, mentally, emotionally, maybe one day we'll become spiritually healthy and we're able to perform those functions successfully. And if we are healthy, we can also support our family, our neighbors, our village, town, city, state, and country, and eventually, the whole universe. So they came from a culture where we considered Vasudhaiva Kutumbakam, and doesn't matter where we are, in the United States or in India, our ultimate goal is to spread health and happiness. So without health, there is no happiness. So regardless of where we are, if we are here or if we are in the India, it just doesn't make a much difference. And especially we have seen that with the COVID-19, the Zoom calls and all these things basically became accessible, and we are seeing patients from here to India and all over the world. So basically the limits are not there anymore. Then I'm thankful to many other renowned people, wise people who came before us, who spread the word of Ayurveda in the Western world. Again, we have known about Mahesh Yogi ji. And then I also know some more name. Again, I can't remember everybody, but there are many. Dr. Lad is well known. Dr. Uh, Dr. Frawley, Dr. Chopra came, and then basically Dr. Shekhar started Apna, which is very successful and have more than 100,000 members. So thanks to him to spread the word. And then there's a new organization started recently, American Association of Ayurvedic Practitioners. Dr. Vivek Shanbhag, I'm so thankful to him because he has taken this task to not to just to bring the people or Ayurvedic professionals together and support them as much as possibly can. Dr. Bhattacharya, Bhashpati Bhattacharya, who is well known in the medical MD field and again a PhD in Ayurveda. I'm so thankful to her to be part of this journey and to know her. And one thing I'll tell or ask everyone who is practicing in US or planning to come to US, she have developed a survey, is the clinical practice survey. And basically it is trying to find the Ayurvedic practice in the US, what we can do or what we are doing and what we think what should be done. And again, based on that, her journey or goal is to promote Ayurveda and to make sure that we can do better. So if you have access to that, please complete that survey. And if not, go to our website, AAPUSA, or as Dr. Shekhar, he have access to that, and or you can send information or ask me or Dr. Bhattacharya. Our email and information is well known. So I'm thankful to all these people who have spread the word of Ayurveda. I'm here since 1984, 85, early 84. So basically started practice at that time. So a lot of years in the beginning, practice of Ayurveda was kind of difficult because the people did not know about Ayurvedic medicine. When you tell them Ayurvedic medicine, this is what kind of medicine? People, they have not heard of that. And then we start telling we treat with herbal medicine. And eventually came to a point where Ayurvedic medicine became even more acceptable here in some areas and some group of people, even better than India. So what I've seen, people here are very open. If you are open, if you are authentic, if the practitioner is clear in their instructions and also making sure that he and or she have the knowledge and understanding that this is going to benefit my patient. We always remember one thing: first, do no harm. That even though your herb may not do anything better, but at least you make sure it does not make the symptoms worse. And second thing is, we must remember the healing power of nature and trust the nature. So that's where we come to the Brahma Muhurte or food or soup or starting your day with warm food, not the cold cereal, or do the Surya Namaskaram. All these things are part of this healing journey where our forefathers, our ancestors, and our rishis have put this together in such a way that if we follow that lifestyle, there's no reason that we will be sick. Ultimately, we will get better. And if we follow that, we definitely will get better and stay better, stay healthy. So those rules and regulations were provided to us as a guideline, not to make our life difficult. Oh my God, I have to wake up at 4. No, it's just a journey. If you want to be healthy, then you follow that. So I tell my patient, no pain, no gain. You have to struggle, you have to work some hard. And basically, don't make this so easy because life was not easy. And recently, I was talking to my daughter, who Dr. Shikhar mentioned, just she's also a naturopathic doctor. And she said, life is roller coaster. So if you're looking at the EKG, is all upside, downside, all the waves. As long as that is there, we are living. But when that line becomes straight, that is death. And in that case, we always keep moving, keep doing something. And Ayurveda gives us such a beautiful guideline, which through the Dinacharya, through the Ritacharya, all these things are there. But we have to understand that first, like Dr. Shekhar was giving example of obese physician. People look at us, and if we are living that healthy lifestyle, they'll follow. But if I'm standing outside my office and smoking a cigarette and telling my patient not to smoke, that doesn't work. So following that, so practicing in US, you have to follow the discipline and make sure you follow the law. So number one thing, if you are a Ayurvedic graduate, BMS or MD from India, and are already here and need some guidance, make sure you contact AAP USA or APNA, Dr. Shekharji, Dr. Vikji. These people are there to guide us so that you can be successful. If you're planning to come, again, contacting these organizations will be useful. But again, keep one thing in mind, that when you are practicing here, make sure you register yourself as a business. And once you register, then definitely take some kind of insurance. Malpractice insurance is available. So basically you take those. So some kind of insurance is very important. Knowing local laws, there are a lot of things which we can do, and there are a lot of things which we cannot do. So in 11 states in the US, there is called the Health Freedom Act, which means the consumer can choose whatever system of medicine they would like to be treated with. So in those states, if you're practicing in those states, then basically you can practice under that Health Freedom Act. I think New Mexico is one of the states. Arizona have limitation only. It's providing only for homeopathy or homeopathic doctors, not to, I don't think about Ayurveda. Then we have Colorado, Nevada, I think Maine is there, Oklahoma, Idaho, Minnesota, Rhode Island, California, Louisiana. So 11 states. So if you're practicing there, definitely you have that sport there. There was a bill called the Safe Harbor Practitioner Exemption Law. That was also a bill that protects access to healthcare practitioners who do not hold state occupation license and are currently practicing in public domain. So there are some protections as long as we are not doing something which we are not allowed to do by law, since Ayurvedic practitioners or Ayurvedic doctors are not licensed physicians in the US. Counseling, definitely, you can be a counselor, health counselor, consultant. You can also tell about their food. And again, in Ayurvedic medicine, we always start our journey with ahar. So when we are treating a patient, we always start with ahar, vihar, and then comes the aushadhi. So do not jump to the conclusion, let me give a bag full of supplement to this person and make a lot of money. If we are running after the Lakshmi, then we get nothing. Go for Saraswati, Lakshmi will follow. So know the knowledge, you have the knowledge, and things will come. That is not an issue. But once you build the trust and you know what you're doing and your patients feel better. So do not jump to the conclusion, let me give a bag full of supplement to this person. Somebody is recording and playing that back. So if you are doing that, please basically hold that, because creating an echo. So in that case, when we know our ahar vihar, that's where we start. So there are many. Again, there were times when supplements were not available, and I started my practice as basically a consultant, and we go over people's diet and make changes. So just making change in the way they eat, make changes in their health, their lifestyle. Starting your day, with cold cereal and cold milk from refrigerator is not something recommended. So if you just change that to a warm breakfast, warm, fresh cooked lunch and dinner, more plant-based diet, more fiber as well as protein, which is plant-based in your diet, is going to be useful. So making some changes, of course, by waking up in Brahmurtam, but there are a lot of people who can't. They are sick or they work in the night shift. We just give them some other options, going for a walk, play with your pet, a dog, or usually with dog or cat, whatever you have. Just brings some happiness. Otherwise, life becomes stressful. And most of us who come here as first generation immigrants, we struggle, we work hard because we want to be successful. But hard work is important anywhere. And again, as a Ayurvedic physician, you take that responsibility to work hard anyway. Since this is not something for your luxury, we always recommend individuals that you must have a purpose in life. And this, if this is your purpose, then nothing else is needed, because there are plenty of people who will need your help. So to practice again in the US, you can practice as a consultant, or then eventually if you want to get any secondary education, as a many people will do, as a massage therapist, to able to touch the patients, or to get acupuncture degree to become as acupuncturist, or naturopathic medicine. That's a 4 year of medical school, which also gives you a lot of information, but also gives you a license to practice in many states. And depending on the place to place, your scope of practice will change. But as we know, we are not allowed to do surgery. We are not allowed to give injectables. We are not allowed to give any chemicals. But as long as we stick to, again, our supplements, which are pure, and also making sure that they are not taken from a cheap place, which may have fungus or anything else growing there, mold growing in there, or may have heavy metals. So you want to make sure that we get those from a tested company which tests for heavy metals, basically lead, mercury, arsenic, and cadmium are the four neurotoxins. We want to make sure that these are tested for those. So as long as we are following that, there is no reason that the practice will not be successful. We play safe, provide safe medicine or supplements to our patients, and also making sure that we know the local culture and not use things which are not allowed in the by law. Rush these, even though they are great, but again, if they can cause any side effect or anything else, do not go into get into controversy. Even though we know they are healthy, they can do a lot of things, but nothing controversial, because we are not equipped yet to have that power. Once the Ayurvedic profession is accepted at the national level and as the governmental level, which means that few states getting license, then there's a different platform, there is a different support system we have. But right now, since we do not have that, we have to make sure that we use herbs. Also, basically, in the beginning, we used to get a lot of herbs from India, and then had this issue of the purity. And then there are a few companies who started making supplements here, and are have fortunate to have access to those. Ayush is one who started that many years ago, and then very basically pure supplements. Then Shri Sai Nutrients came, Vedic Nutrients came, and there are many companies. So Binary Botanicals. So there are many companies who are here, and so local companies. Again, the companies in India, Gesni, Chandu is there, Dabur is there, Vedanath is there. They're also providing a lot of good supplements, and I also request them to make sure these are tested for heavy metals, and all the ingredients which are not allowed in the US should not be there, because once somebody is basically caught because using them create some problem, and then definitely somebody will report. And there are medical associations here who do not like any competition, and then some these samples of the supplements are sent to the lab, and if they find something, then it goes against the entire system. Like Dr. Shekharji was telling about this 2002 study, and even though in that one there were flaws, and if we found these were not collected from practitioners, these were from the stores. So that is one more issue we have in Ayurveda. I'm not sure if it's a part of our culture. We do like to mix things to make it cheaper. Uh, so if we are sending something to US to a practitioner, then that will be export quality. Well, why not have the same quality for export and for our own people? So my own people back home can eat whatever is with a lot of arsenic and a lot of lead or a lot of mercury. But if I'm sending something outside, then we want to make sure that we give them the pure. So I know our culture is basically we look at the guest as a Bhagwan, and we provide them the best food, and whatever is left over is for our family. But that doesn't mean that when it comes to medicine, we also do the same thing. We get this leftover junk and all these toxins to our own people. And we see that the heavy metal toxicity is so high in our Indian population. And we also know that the India has become the basically kingdom of diabetes. There's so many diabetes are there, heart attacks, all these conditions. And similar conditions happen here with mostly many of the Indians, because they come as Indian and they live as Indian. Nothing wrong with that. We should remember always where we come from. But what happens? The habits don't change. If I'm coming from southern part of India and temperature was 120 degrees and I was eating rice and curd every day, fine. But if I come to New York City and it's freezing in the winter and the winters are so long, there is so much snow, and after turn that into ice and summer is very short, and I keep the same lifestyle, then doesn't work with me. I can't use a lot of coconut here. So we have to change based on where we are. According to the Kal and Desh, we change. So now we are not living in a hot weather, and I can't be using cold food all the time. And that cause congestion and eventually cardiac problem. So I had to change according to that. And that education is very important. So as an Ayurvedic practitioner, when people come and they says, I've been eating the same food, I am stick to my Indian food and I am eating, that is fine. But then Indian food have to change. You have to add some spices, and instead of yogurt, you may want to choose something else. And yogurt is good in the summer, but not in the winter night. And they'll say, well, I end my food, we end well food with rice and curd. Well, that was necessary when you were living in Kerala, but not important when you're living in New York City. So according to that column, they should change. Again, that is important as we understand our own philosophy and our own basics as the ahar. So ahar plays a huge role. And instead of giving somebody magnesium tablet, if somebody is stressed, we like to tell them, no, eat beetroot, chukandar, basically has a lot of magnesium, or buckwheat has a lot of magnesium. So go with the ahar first. And then, of course, the vihar, the lifestyle is very, very important. Like Dr. Shekharji was telling, waking up in the morning. So I tell people basically the repairman comes in the night between 10 to 2 a.m. because there's the pitta time, and make sure you are sleeping. Otherwise, if you're not sleeping, the dark hormone, the night hormones, or melatonin is not produced, and you don't get rest, and especially your repairs are not done. And many people will keep watching TV. Especially, I found that in mostly foreigners who are immigrants who came here. They stay late until 2 o'clock in the morning and watching TV. And so that this is must. And then comes to the supplement. And supplements, like I said, nowadays there are so many good supplements available here. But make sure you are not trying to save pennies and then get something cheap, because that is 50% off. Look for quality. And so keeping those in mind, what I've seen from 1980s to now, we are basically going to the 21 is almost over. Big change. The individuals here, the public here is very open. They are more open than we are actually, even though we always says everybody's welcome, which is not true. I am from Haryana, and if somebody comes from 50 miles, then we call them Punjabi, or this guy is from UP. So there are very few Indians there. We all living over by state. I meet somebody, say, where are you from? I'm a Telugu. It's like, no, they want to know the town or city. Basically, it doesn't mean. So they'll refer themselves as where we have come from. That doesn't exist here. These people are open. If you are good in what you do, they will accept you. And so what I have found, once you use good supplements and you have treated people successfully, the word of mouth goes far, far, far from any other kind of advertisement. And people will come to you and they will trust you completely. Whatever you tell them, they will follow completely. where I found in many individuals who come from India, they do not follow your instructions because they know better. And sometime it becomes a issue when that come, because I know, well, why you are here then if you knew? And so they will go their own knowledge because their neighbor had this disease, or their mother's aunt son had this disease, so they will follow the same thing, and they will get supplements from India also. Sometimes they have heavy metals, and that becomes the issue. So so working with individuals, you have to make sure basically you win their trust. They will, again, they like to look at you, who you are and what you preach, and if you are practicing the same thing. But as long as you're not using any heavy metals, as long as you are using herbs which are pure here, and as long as you are following the rules, again, not to do something, even though it could be just minor thing, but anything which is beyond your scope of practice, because even though you have the training, but something which is not allowed here, make sure you do not even try to do that. Make sure you make connections. So one thing I learned my early days, days of practice, make contacts with local practitioners, DOs, MDs. So basically, you may need sometime a blood report, and so you may refer them, and you go there. They are basically, introduce yourself. I'm Dr. So and so, and then that's what I do. Most of people now know what is Ayurvedic medicine, and they will love you for that. And one thing I found, they do refer a lot of patients because they have no knowledge of nutrients or nutrition or diet, what should eat. They will tell, eat whatever you want. And that is where you come and you tell them, basically, I am not a medical doctor, but I do know about nutrition. I do know more about the digestive system. I know about prevention. And keeping that in mind, if you introduce, then they will be with you. And again, I have many doctors who have sent me requests to meet. Just how the grace of God, my practice is so busy. I'm having difficulty finding a day to meet them for breakfast. And that's my goal. I'm going to take a few days off and basically reintroduce and meet with those individuals, because many individuals are looking for an Ayurvedic practitioner in their group where they can refer patient to you. Only thing is, we don't keep that patient. So if you're practicing here, make sure if somebody refers you a patient for something, you do that part only, and then tell the patient, go back to your physician and let doctor, I will talk to him or her, and then we will discuss how to proceed. You don't steal patients. Once you do that, they will not refer that again to you, because if you start telling them, I'm an Ayurvedic doctor, I do know all these things, and I have such a training, and you don't need anything. No, just send them back. But also, a lot of places, the public need education. So that is also very important. Any patient who comes to you, we educate the patient, and also we educate the public. Whenever you get an opportunity, you go there and talk. Again, it's a free talk. You're not always there for the Lakshmi, you're always there for the Saraswati. Give the knowledge, and everything else will come, and people will come. So that has been a journey for almost 38 years now. I started talking in different places, and mostly they were free, and many times they will invite just because they do not know what this is, just for the fun of it. And at that time, early days, I used to be invited because not only they want to learn something about a different system of medicine, but also they will invite because I had a funny accent, and then there were very few people with that accent in the southern part of the US. So they'll invite and they will listen many things they won't understand. But now the public is more open, so education have become an important part. And with that, Apna have taken this responsibility, and on top of that, Dr. Sodi, Dr. Bhaswati, the AAP has also taken the responsibility to make sure that we carry that banner and flag of educating the public, which means education is the key. Our Ayurvedic medicine had been diluted and diluted and diluted to such a level that it has not left much of a meaning. I had an Indian coming to me one day, and she said, "And you have a school." So we have a school where we teach Ayurvedic medicine. And she said, I'm an Indian and I know most of Ayurveda. So can I get a certificate? And I asked her, how much you know? Well, I'm an Indian. I said, I know that part. Your look tells me that you're an Indian. Well, I know how to make khichdi. I said, so what does it mean? Uh, she said, well, I had a doctor coming to my integrative nutrition certification program. And he said, if you know how to make khichdi, and if you're patient with khichdi, and if you knew some spices, you know more than 50% of Ayurveda. Well, that is something, a misconception. That is something, if we consider that Ayurveda, then every mom is a PhD in Ayurveda or MD in Ayurveda, because she knows a lot of spices. But those spices are not there only for cooking. Our ancestors selected those based on their gunas and their prakriti and their benefits. Basically, if those were basically herbs. And what they found is those herbs are so beneficial that if my children and their children and their children and whole community takes them on daily basis, they will stay healthy. So that is why the turmeric, saffron, cumin, coriander, all these were moved from the grocery store to our kitchen pharmacy and were called spices. So we use them every day. Otherwise, they don't have any good taste. I mean, turmeric doesn't have a taste. It's not tasty. Coriander doesn't have a taste. Chili burns. So all these things don't have a great taste. This is not jaggery, which is sweet, or this is not raisin, which are sweet. So they have no taste. The reason they were put in our kitchen pharmacy in the spice jar is just because those can be used every day. And so in that case, again, what happens, we are not using much of a turmeric anymore because it stains the counter. Whereas Westerners are drinking turmeric golden milk every day. And so again, I see many Indians who are not eating ghee because it has high cholesterol. Whereas now Westerners, because the study came, I think 6 years ago, that for detoxification, fat is required. And we know that. And that's why we use a lot of fat in our panchakarma. We do that basically when you're looking at the snehan internally, out and externally. The snehan is there just because it is going to dilute the toxins which are fat soluble. So the modern science tells that 99.99% of toxins are fat soluble, and that's why it is difficult to get rid of them. And Ayurveda, even though does not explain in that language, but it does say we use snehan. So we use snehan, we use snehan outside oleation. All that oils are used just because when they go inside the body, they will dilute the toxins, and then the lymphatics will pick them up, and body will be able to get rid of them through liver. So liver is the organ, and we support liver. And that's why in Ayurvedic medicine, the feelings play a huge role. We always ask how you feel. Doesn't matter what your blood report says. If you feel you are not doing well, you're not healthy, you're not healthy. And we know that. Swastha and Indriya, basically all we need to look at that. When we look at the paribhasha of swasth, we also know that when the mana and the Indriya, all these are not swasth, then we are not healthy either. So detoxification tells that we need to do a lot of oils. So Ghritam is very important. But I find many practicing Ayurvedic doctors and a lot of Indians don't use ghee because it's going to increase their cholesterol. So I tell them cholesterol increases because you're sitting on your couch all day. Get up and go for a walk. Whereas after this study 6 years ago, when it came again, this was study done by a group of physicians and researchers in the West, in the US, and they said for detoxification, fat is important, and the best fat is ghee. So after that, I have seen many places giving ghee in coffee. People drink ghee in their coffee. And we are not promoting any of that because it increases cholesterol, because we are lazy. So in that case, we come back to, I said, somebody says, well, I was eating ghee and then my cholesterol went up. I said, the first thing you should learn, and he read that somewhere, and ghee is not good now anymore. I said, whenever you read something, read also the dinacharya and the ritucharya. Get up in the morning and go for a walk. So you just can't be eating ghee in your food and then you just sit in your office all day and you come home and sit in front of the television for next 6 hours, and then you go to bed, and then when you are going for a store, you're circling around 6 times, looking for a parking place right outside the door. So if you're not walking, no exercise, and stress, that is what happens. Otherwise, the system, it's such a great system that it only gives a lot of health. Also, for practitioners who are here, offer something to your community. Some free talks, Also, there are events which are sometime Indian events, other cultural events, other community event. You go there with a free mindset that you want to give them free pulse and tongue analysis, at least tell them something what they can do to be healthy. And those things I have seen in the last 35 years helped me a lot because I started offering those free services. And then I found that the eventually the seva bhav, your own purpose of life. And I found in 2006, 7, the purpose of life was just not practicing and making money. So I started going to India. So now I go to India every year, sometimes 2 or 3 times, to offer or hold free medical camps in rural India. So I have done those in Haryana, Punjab, UP, Bihar, Orissa. So some states wherever I could speak the language, we went, and with that I found my wife goes with us, and my children now they go with us. But 7 more physicians who are Ayurvedic doctors who were my classmates in Ayurvedic college in Kurukshetra. So they joined in the journey, and we see roughly 472 were the lowest number, and to up to 1,700 patients in that one day, depending on how group we get. So we offer those camps in different part of the country, and that has become our journey. Right now, also during COVID, which we have done that most of the small places like different temple places of worship, the priest had no other income because people stopped coming, and so we were spreading the word. Anybody who need help, they can just call us on WhatsApp, and then we will go over the whole history, call them back, give them all the supplements, send them from here. And so with the grace of God, we are able to help a lot of people. But practicing here, like I said in the beginning, actually is up to you how much you can do, depending on how much you can grow. You can grow from 30, 40, $50,000 a year to half a million or $1 million a year. There's no limit as long as you know what you're doing and you have enough staff. So one thing the American consumer want, that the enough staff is there, is clean, it is basically presentable, and your staff is sincere and there with the seva bhav, which means not to treat them like, well, get out of my way, and just be, because people come with their concern. They're already there because they have pain or they're suffering from something. And your goal is to give them the best you have, an honest opinion. For example, you see a lot of cancer patients. So I'm not an oncologist, but I found that Ayurvedic medicine, and with that, my trust even became deeper. Ayurvedic medicine, if not everything, can treat many things, a lot of things which we have no clue in modern medicine. So in cancer treatments, I found Ayurveda such a great system to heal. Not at 4th stage. If somebody have such an advanced stage, I tell them there is nothing I can do. It's late. But if you are in the 1st stage, 2nd stage, and some 3rd stage, as long as it has not metastasized to the brain, we were able to help people come back off that stage and become cancer free for a long period of time. But all depends on the patient also, if they are following the instructions or not, and that's where the education came. So going back, basically, the practice of Ayurveda in the West, in the United States, is possible, and possible very successfully if if we are practicing within our scope of practice, which means do not use any chemicals, no drugs, even though you might have brought something from back home. Do not even keep that in your office. You're not keeping any Ceridon or aspirin or all these things in your office, thinking like, oh, they have pain. No, we have 2 offices now, and both are doing very well. Nothing at all, no chemical, basically, because there are some people who are looking. Do you have an aspirin? They're testing you. We don't keep that. We have nothing of those. So basically, in that case, you should be basically, and make sure the place is clean, such that if your food drops from the plate, you should be able to pick that up and eat. It should be that clean, because that is what Americans public like. They want a clean place. That's the first impression, you and your staff. And also you practice. If I'm a short person, I will not advertise that I can make you tall, because I can't do that. People will look at me, how come you couldn't increase them? So you tell only, so only whatever you are telling should be true. Whatever you can do, you tell, this is what I can do, this is what I have experience with. This is what I know. And because after that, once you fail, then your reputation has gone down. So basically, you also want to take this is what I know. And with the improvement of your gut health, others will improve anyway, because that's the only entry of nutrients and supplements and food and water and everything, whatever you drink in this body. So your heart, lungs, kidney don't eat. They eat whatever is cooked in the kitchen, in your gut, in your digestive system. So it means you keep that, and that is where the basically we want to make sure that that is the lesson we tell them. Let's start everything with the gut health. So this practice is successful, but with that we also need to make sure we follow the rules. We make sure, even though many Indians, including ourselves, sometime we go to India and we bring something for our family, there is absolutely no in your clinic, in your practice, and you will not even suggest them. You said, tell them that maybe in India this is what people have used, but again we are not allowed, because people sometimes will buy online and then will tell you, ask you to write that on the prescription, this is what you suggest, and then they will take that to their MD. This is what my Ayurvedic doctor have suggested. And if this person who is always looking for something to go against you will report that, and that becomes a problem. And I've seen many patients, even though they are tired of their MD, but then since they have seeing this person for many years, they're tired of this medicine. They know this person have failed, but still the trust is there. So they will take your prescription and take your supplement, and then will show them, I've been going to this Ayurveda doctor and he have helped a lot of my patients, a lot of my friends, and this is what he gave me. So absolutely no anything which you are not sure about, or which may have some heavy metals, even though they are going through the Marn Shodhan Vidhi and they are good. But again, if the law doesn't say allow them, do not use them, and not even write on their paper telling them you can take this. When you go to India, there are a lot of practitioners there. They will tell you, here in this country, this is what we use, and always get your supplements from the best place you can. But again, register, because if eventually when we are allowed to practice, then what happened in most of the states, when I realized from the experience from naturopathic medicine, other system medicine, that when they were grandfathering these individuals who are practicing already, they look at those who actually are registered, because they should be in their system for how long you have been practicing that medication. Okay. So with that, I think I will say one thing, and because the timing is there, and that the key is the education. So we do not dilute Ayurveda to a level where that is you don't taste Ayurveda anymore. It just becomes plain water. So we need Ayurveda, and we need the authentic Ayurveda. And for that, associations here are working hard. So Association of Ayurvedic American Association of Ayurvedic Practitioners was established just based on that, just one thing: education. We want to bring back the authentic Ayurvedic education in the West also. And with that, I'm sure we will be able to influence the East also, because what I'm seeing, when I went to Ayurvedic school, it was 6.5 years program, and somebody was telling me now it's a 4-year program. The history, philosophy, all these are gone. Without the root, without the base, the building doesn't stand that tall. So we need to bring that and make sure we understand the headache doesn't mean we give something for the headache. It means we need to look for the cause of the headache. We need to look if the person have been in digestion, if the person have a lot of gas, a lot of burping, if the person have basically something, a tumor, or person didn't sleep, or person's eyesight is weak. There could be so many reasons, not just you have a headache, let me give you this, then you feel better. And when we don't have our basics covered, when we don't have the foundation, then we do deal with those issues and becomes a problem. So Ayurveda have a very strong root, and we need to remember that. Ayurveda have a very strong foundation, and we should stand on that and make that our foundation. Ayurveda have a big history, and we learn from that history. And based on that, we should continue more research. At the time Ayurveda was developed, we did not have 95,000 chemicals being used in daily routine. So that's why we did not deal with a lot of chemicals. Even though at that time, even though everything was clean, people were still sick and people were still toxic. And that is why a panchakarma was developed. Otherwise, there was no need. So now it is even more useful. Anybody who's practicing Ayurvedic medicine must also use therapies like panchakarma, and because these are the basics. This is our root. This is the core of Ayurveda, because we need to detoxify first, clean the source. As long as you have the source of sickness, then person will develop something. So clean that source first, and then boost the immune system, and after that you clean the sign and symptom, and after that you rejuvenate the person, so the person will never get sick. And then when other individuals see that, they will ask the person, where did you go, what have you done? And that's what we need to do for Ayurveda. So Ayurveda at this point need us, because we need to make sure we become the ambassador of Ayurveda. Thank you very much.
Excellent, excellent, sir. Excellent. Really, it is a great opening today where our both opening experts batted like test match. Excellent, sir. Excellent. These are the real blessings for both of you, from both of you. Really, really, sir. Tomorrow is T20 match because 12 speakers are there. 12 speakers from UK. But today, really, I was remembering Sunil Gavaskar and Chetan Chauhan. Really, on that time, they were the great opener and they batted for 2 or 3 days even. Really, salute, sir. It will be very unwise to, if I forget Dr. Vaswati Bhattacharya to invite. She is well known to me during her short involvement with Imami and during her BHU phase. So I would like to invite for 5-10 minutes Dr. Vaswati Bhattacharya, though she was busy, very busy, that I couldn't receive her photo and details. But welcome, welcome, Dr. Vaswati ji. Dr. Vaswati ji.
She doesn't need photos, she is everywhere.
Yes, yes, yes.
Namaste to everyone. So is there a particular thing you want me to talk about?
Your valuable blessings for first program. It is our inaugural global AYUSH series.
Yeah. So you don't want me to talk, you want me to just give blessings. So
No, I want to talk. I want to invite you for talk as a specific day for Dincharya. You are the expert on that topic, no doubt. But today, please guide us how to go to USA and practice. That will be.
so Pavan, you had invited me on June 22nd and said that I would be a speaker for this particular session, and it didn't happen. So I'm not going to speak because you obviously, if you had wanted to invite me, you would have. Okay. I'll just make a couple of comments. Somesh and Shekhar have been practicing for a very long time. They obviously know how to practice in India, and they know now for over 30 years, both of them, how to teach. So there are many different ways that any doctor, whether you're an MD, an ND, a BAMS, or any other kind of doctor, Unani doctor, Siddha doctor, we're all doctors. We're all looking at the profession of healing and health. And so they were giving their perspective. And I think people who have multiple degrees, as Somesh and Shekhar do, as I do, we have more scope because we can be teachers, we can be researchers, we can be practitioners. So, they talk about the triad of clinical, research, and education. So they shared a lot of those, diverse professional activities within their last 35 years of each of them. Most of the people who want to come are not having that level of diversity or understanding yet. And there's just a few things I want to add. One is that as much as we think that the people are so professional, people that are doing Ayurveda in America, since 1999, there's been an organized effort. No one till date has put together a written collection of information. And the question is why? Why have they not done it? Somesh discussed with you that one of the problems that we have to defend ourselves in a land where people do not support Ayurveda very legally for sure. You know, what he said about writing prescriptions is very important. If you have an ND or if you have an MD or another degree, you could write, but you can't write the Ayurvedic prescription in a medical way. So I'll just give a couple of things that I tell my students and people that come to study with me. Number one, don't write your prescriptions in medical language. If you write your prescription, if you say the person has GERD, G-E-R-D, gastroesophageal reflux disease, you are prescribing for a disease. You are diagnosing, prescribing, mitigating, preventing, treating a disease. Don't do that. Write Amlapitta or write Grahani or write whatever you think the actual diagnosis is from the Shastras as a AMS doctor. Then no one can accuse you of practicing. The laws that say that you cannot practice medicine are not referring to Ayurveda. So technically, there's nothing that says it's illegal to practice Ayurveda. And this is something which, for whatever reason, the BAMS doctors cannot figure out. And I have talked about this up and down, you know, shouted it from the rooftops and tried to tell it in many seminars. And the Ayurvedic physicians do not understand this. Sorry to say this to Shekhar, but you know, I will challenge you to find me a law where it says it's illegal to practice Ayurveda. So you just practice Ayurveda, write it as Amlapitta, write it as Grahani, write it as Arshas, write it as Prameha or Madhumeha or whatever you think it is. If you write in the Sanskrit and you do it according to dosha, dhatu, pathophysiology, samprapti, then you will not have any problems. You can practice. It's when you try to say you have diabetes and here's a medicine for diabetes. You cannot call it diabetes because diabetes is the language and terminology of modern medicine, and you don't have the right to practice modern medicine, as Dr. Somesh rightly said and as Dr. Shekhar said. Now, Somesh cannot practice naturopathy in New York, but he can practice it in Connecticut because naturopathy is not licensed in New York, but it is in Connecticut. I think that's still correct, Somesh, as
Yes,
far as
absolutely. Yes.
I know. I don't think the last 5 years anything's changed since.
No, nothing
So,
changed.
yeah, so just write your prescriptions. The thing that is missing the most in India and in America, I am yet to find one Vaidya anywhere, including my gurus, AVP, BHU, Udupi, any of the places I've studied. There's no one that writes a good Ayurvedic prescription. It's not written properly. It's not given with the right anupan, sahapan, timing, meals. It's not given. And that's a big problem because patients do not know what sheher is. Sheher is honey, but you think you're giving honey. They go and they buy Dabur honey or, you know, in the Indian store, or they buy American craft honey. That is not honey. That is high fructose corn syrup force-fed into bees who are then pushed to vomit it out. It's collected, so it's technically from the bee, and it's called honey. And it's not actual honey the way we know honey. So you have to know the process of every food. Learning food processing is a second lesson, I will say. If you're going to do Ahara Vihara, you have to understand the lifestyle, as Dr. Somesh and Dr. Shekhar talked about, waking up at 4:30 in the morning or knowing lifestyle. Really understand the American lifestyle and then do Vihara. You cannot understand it. Well, maybe you can if you sit in Delhi, because Delhi people basically are like Americans with brown skin, because they really, really emulate the American lifestyle in Delhi, the rich ones especially. But if you're not in Delhi, it's really hard to understand American lifestyle unless you have lived in America. Shekhar is married to an American raised Indian person. So he and his two sons are American. So he understands American lifestyle and knows what the patient is coming in with. Somesh has been practicing for 38 years. He also knows. So if you don't know that and you're doing telecommunication, teleconsultation from India, or you just moved, So there was one woman who is a fantastic Ayurvedic doctor, moved from South India to America, and was telling me she wants to practice, but she couldn't understand anything about the lifestyle. And she really made a lot of mistakes, a lot of mistakes. Okay, so that's, the second thing. So if you're going to do Ahara Vihara, learn it. And if you're going to practice anything of Ayurveda, write it in the Ayurvedic terminology. The third I want to say is make a list of the different companies that offer herbal and Ayurvedic supplements. I don't like using Himalaya herbs because I don't think that it's really made, it's got a lot of fillers and preservatives, and they're not really the authentic. I mean, you can have tulsi, but it's not actually tulsi. I like using Zandu. As Pavan said, I was on the board of Pavan, was I on the board of directors or advisors? I think advisors, right? 4 years at Imami. I like their products, and you can get them by going to Distacart, A to Z India products. There's so many online where Americans can get Indian formulations. Like for Amla Pitta, Haridrakhand, Amalaki Rasayana, you can get those as is. You can get Avipatika Churna, you can get the Trivratlayam, you can get all of the things that we need that are multiple formulations. But if you are going to help people learn single herbs, use Organic India USA, use Banyan Botanics, use Mountain Rose. Look behind Shekhar and you will see he has a beautiful pharmacy of herbs that he's gotten from 6, 7, 8, 10 different places. And Kotakal now is in New York, so you can order from them in the USA. So get to know your herbs and use them, but don't call them medicines. Call them herbals, call them supplements, call them Ayurvedic medicines. Most of the errors that people make are about the way that they communicate, the words that they use. Ayush currently is stuck on, they're obsessed with this whole thing of it has to be called Ayurvedic medicine. It has to be licensed. This is a game that they are playing for, I don't know, power reasons. But power does not have to do with the patient. Power has to do with governmental egos. So if you're trying to help a patient get better, don't worry that you can't call it that you can't call it medicine. Just call it an Ayurvedic supplement, Ayurvedic medicine, or a herbal product, or an Ayurvedic herbal medicine. And then just prescribe it to them. And make sure your instructions are clear. Most of us have templates that we use. I have my template of things to do for sleep hygiene and things to do for lowering vata, lowering pitta. I don't tell people that, well, I'm an MD, so I can do all of it. I can give rasoshadhis, I can give all kinds of stuff, and I do. But for the BAMS doctor, obviously you should just practice Ayurveda and don't try to call it by English terminology names. The last thing I'll say is that there are many people that are interested in what Ayurvedic doctors are doing. And most of them, actually yesterday, one of the heads of the NIH, one of the groups, wrote to me because he's getting invited to Pratibha Shah's conference on Council for Ayurveda Research. And he's asking about it. They don't know anything about it. So there's a real eye toward Ayurveda by the governments and by the people who are interested in Ayurveda. And as Somesh said, they have no idea. So it's up to us to be on our best behavior and do it well. Because if we do, we'll get recognized. We'll get recognized as a profession. The reason we haven't is because, the last thing I'll say, most Ayurvedic physicians do not know how to teach, which Shekhar said. They are not articulate and well presented. Like right now, I'm not wearing any makeup. I haven't dyed my hair, and I'm not sitting with a perfect background behind me, right? Because I wasn't expecting to. I'm not wearing my suit and tie like Somesh and Shekhar are. So, well, Shekhar's changed into scrubs because I think he has a whole bunch of karma session today. But you should be presentable. You should be professional. But you should know how to teach. You should know how to answer questions directly and not go on tangents. And you should have facts. If you're going to mention a paper, you're a doctor. You should have the reference. You shouldn't just say, oh, I think the paper was somewhere in 1950 or 1980 or 2003. You should have the reference. You should be professional. And that's going to make a real difference. So if you don't do those things, if you don't give clean prescriptions that are well written and people, your audience can't understand you, we're not going to move Ayurveda forward. And I've been pretty much disappointed seeing how every organization that's been mentioned so far, and NAMA, which had not been mentioned yet, how these groups lack the ability to write things out and actually educate people. No videos, no write-ups, no blogs, no columns. Why? So congratulations to Dr. Pavan for putting this together and being one of the first people to actually have a seminar on the practical issues about scope of practice of Ayurveda, or not just scope, but the scope for Ayurveda use and practice in the USA. Shekhar, is that enough? Was that helpful?
Yes, yes. Thank you. Thank you. Thank you. Excellent, Dr. Vaswati. Excellent. By all three speakers, we have been motivated and inspired, I hope. And there
Don't
is
call me a
Apna
speaker.
to support all.
Don't call
Thank-
me a speaker. You didn't invite me properly. Just say I was a comment.
Thank you. Thank you. Thank you. So I would like to thank all the speakers and now would like to invite Dr. Vishnu Prasad Sarmaji for his concluding remarks, ex-principal, Guwahati Ayurvedic College and President Vishwa Ayurved Parsad, Assam, in charge North Indian states for Vishwa Ayurved Parsad. Welcome, sir.
Yes, thank you. Good evening and good morning to everybody. Respected Dr. Pawan Kumar Sarmaji, respected Dr. Alok Sarmaji, today's eminent speaker, ladies and gentlemen. Today, Ayurveda scope and practice in United States of America, all the speakers, they have presented their talk very nicely. First of all, I want to offer my sincere thanks to Dr. Shekhar Annam Bhotla for his excellent presentation. Dr. Shekhar nicely described how to practice in United States of America. He had 33 years of experience. He expressed this. Ayurvedic expert does not want to share what type of medicine used for the disease. Yes, most of the, not most, few of the doctors are there. Few of the doctors are there that they don't want to disclose what type of medicine they use. But rightly says Dr. Shekhar that yes, this should be know everybody. What type of medicine? It is a Gurusi or it is Mondopani, what amount is there? Then we can develop our system. Again, regarding Dr. Shekhar has mentioned that one should wake up in the early morning, Brahma Muhurta, at 4:30 a.m. to maintain our health and follow the rules and regulations, whatever mentioned in our Ayurvedic authentic books. And he said, Ayurveda is a life science. He gave stress, doctor, to be honest. And he said that, yes, you have to spread the knowledge of Ayurveda to the patient, to the public. Again, he gives stress that, yes, Ayurveda knowledge should go to everybody's house, everybody's house. Again, he gives stress to protect the public. Again, he said they organize more conference at their state. And again, he gives more stress. Yes, success comes only from a hard work. Without doing any hard work, you cannot be success in your life. So thank you, Shekhar sir, for your excellent presentation. Namaskar, namaskar.
Thank you.
Next, I want to offer my sincere thanks to Dr. Somesh and Kaushik for wonderful He gives stress, spread health and happiness, trust the nature, follow the lifestyle, whatever mentioned in our Ayurvedic books like Dino Sajja, Ritu Sajja, then it will maintain your health. One should know how, one should know the laws of that area where he or she do practice. He nicely described where we can practice. He gives stress on Ahar, Bihar, then medicine. First, we have to follow the Ahar and Bihar, then medicine. Practice in USA, he said license is required, and heavy metal is a big problem. We have to give stress on that. He also gives stress to educate people. It is most important. He nicely explained the benefit of spices. Whatever we use in our kitchen daily, in our kitchen. Because in ancient time, when we was small, if any stomach problem is there, first our parents or grandfather, they don't want to give any medicine. They want to give ginger, black salt, like that. Then after, by using that, if it is not subsided, then medicine they use. Again, use of ghee, he nicely explained, yes, it is detoxification. It is ghee is required for the body. Again, he mentioned one thing, seva bhav should be there. Seva bhav should be there. He said he do free consultation also along with all the family members. So I offer my sincere thanks to Dr. Somesh and Kaushik for your excellent talk. Excellent talk. Next, I would like to offer my sincere thanks to Dr. Bhaswati Bhattacharya. She gives stress, yes. You always write Ayurvedic diagnosis, Ayurvedic protocol. And she gives stress to write organic single herbs. And she said she is not use Himalaya single herbs medicine, but we don't know, some reason may be there. But anyhow, I offer my sincere thanks to Dr. Bhaswati Bhattacharya for your nice talk. Thank you to all. Namaskar to Pawan
I would
Sharma-ji.
like to communicate sincere thanks to all speakers and of the dais experts also. Please join tomorrow. Tomorrow at 1 p.m. IST, 12 speakers, experts, every galaxy of dignitaries from UK will motivate us, inspire us. Though it will be the time of night in USA, I would not like, because at 10-hour difference, it will be round about 3 a.m. in the morning. So please bless us forever. Thank you, Dr. Kaushik. I am also Kaushik by Gotra. I hope your Gotra is also Kaushik. So after so long time, thank you, Dr. Shekhar, for introducing Dr. Kaushik. Thank you very much. Thank you all. Good
Okay,
night. Good
namaskar
night.
to all.
Thank you,
Thank you.
Agnihotriji. Thank you.
Thank you. Namaskar.
Doctor, namaskar. Namaskar.
Namaskar. Thank you very,
Okay.
very much for giving
Okay.
Dr. Somesh. Thank you very much for joining and giving a time.
Shekhar.
And we have now Panchakarma is going on, and we'll continue our journey. And afternoon busy with schedules.
That's true.
We
That
will
is-
trouble you again, sir, in global AYUSH scope, and that will be inaugurated by Central Health Minister, maybe of Cabinet or maybe of State. Our 200th webinar. I will request you again on that day. Please bless us.